What mental health problems in children have you seen affected by the pandemic?
Sure. I think, certainly the length of social isolation. I think the literature that's still kind of growing and that we're looking at is still probably one of our strongest predictors of some of the future mental illness things that kids might be suffering with. And so that really plays a large role. As I was talking about, part of assessing a child is knowing how they're doing in their community. And so when they lack that community, they really lack a lot of the resources and some of the sustaining, pillars that really help them to be as successful as they can be. And so it's probably no surprise that that we see, and certainly I've been seeing an uptick of kids in my practice who are struggling with, loneliness and feeling of isolation and disconnection, and a little more anxiety than they typically would.
Now, we certainly see that in adults. Do you think the isolation and the lockdown sort of mentality of the pandemic, do you think children are uniquely at risk for that, or do you think it's equal compared to adults?
I think it's been interesting to see. I think the most recent kind of meta-analysis I looked at, actually kids might have been doing a little bit better than parents when it comes to being able to, be victorious over the anxiety and some of the stressful, situations that they're facing. However, parental stress for a child who's been affected by COVID or been hospitalized by COVID is actually quite a bit greater, both on the dimensions of depression and anxiety for their kids who are struggling. And so, and why that's important is, kids who struggle with anxiety, it's not uncommon that, genetically their forebears have had some degree of anxiety too that they've struggled with. And so if a parent is struggling, often that is a vulnerability for the child as well. And so I think that's having an impact as well, even if kind of indirectly, it certainly is on their environment.